Another question that I wanted to ask the Rav is, in the beginning of the pandemic, hydroxychloroquine was the suggested medication, which there wasn't any knowledge on it, but it was suggested that it would have a positive impact on the disease process. And many people initially were given hydroxychloroquine. Subsequently, it was withdrawn and it was decided that it wasn't appropriate medication for COVID-19. Now there's some suggestion in England that they're going to start a new trial of hydroxychloroquine to see if in fact perhaps there is some value in it. The question to the Rav is, we were, and we are, as the Rav said, still very much at a point where we don't really understand this virus very well. We certainly don't have an effective treatment against the virus. Is it appropriate to use a drug at a point during a pandemic when we are not really familiar with how this drug will work, whether it will be effective? We do know some of the known side effects of the drug, and we do know that people did suffer from some of those side effects. Is it appropriate to use a drug in such a circumstance?
I might have somewhat more medical knowledge than the average of, but I need to make very clear I am not a doctor, and I am very careful in stressing that point when people ask me for medical advice. I'm not qualified to give medical advice, but I do say one of the most fundamental principles in halacha that Chazal teach us: when you are in doubt, sheva al taisa odif. And I think that is especially relevant when we're dealing with medicine. So before medicine or any treatment has been proven, we need to be very, very careful. But one might ask, well, every new medication has a trial period. And every new medication, after we try it out on mice, on rats, on animals, at some point, we will never know what effect it has on human beings until we try it out on human beings. But the medical establishment and the scientific establishment in the modern world has certain guidelines. Yes, there is a trial period, and usually we try out these medicines either on people that we have no other option, and their life is in imminent and in great danger. So we don't have that much to lose, but we might have a lot to gain. So there is certain criteria in the modern world how we perform a trial on new medications. And I think we need to uphold that criteria. And sometimes just the hysteria and trying to be the first to come out with a cure or with a vaccine might bring us to endanger many people. So all I could say is the principle that Chazal teach us: when you are in doubt, you might be causing terrible damage, you might be causing great benefit. If you aren't suffered, sheval taisa odif. But if scientists, researchers, doctors feel that the benefit would greatly outweigh the risk, which means side effects would not be life-threatening, they might be somewhat harmful, but the benefit would greatly outweigh the risk. In that case, I would say that yes, it is justified to try out these medicines. But so ultimately, it is more of a scientific medical call than a rabbinic one. But all I could say is, when we are in doubt, and we might be causing terrible damage, and we might be causing great benefit, sheval taisa odif.